Hello, everybody. I am the Proactive Caregiver, and I specialize in educating others on how to be proactive by empowering you, the caregiver. Because if you cannot take care of yourself, then you cannot take care of your loved one. And part of taking care of ourselves and not going crazy is understanding our loved one's needs, especially when it comes to fulfilling them through insurance. So today we're going to begin part one of a two-part series because Medicare is not easy and it is not something to gloss over. Part one, we're going to cover the U.S. Medicare Annual Enrollment period, which is coming up, and this is the time period between October 15th to December 7th. To help us understand this information, I've asked agents Monique and Joe Barajas to join me again today because this information is not for me to even begin to understand, but as a caregiver, I know there are questions that need to be understood. After reading through the current year 2024 changes in effort to find the differences between what we are experiencing now in 2023 and what we can expect going forward, I have a couple of questions that you need to know before you reach the enrollment period. So thanks for joining me, Monique and Joe.
Thank you.
Thank you for having us.
So one of the questions that I find confusing and need help understanding is the actual idea behind the enrollment periods. There's so much information, and it would be really helpful for me and other caregivers to understand what is the difference between the Medicare General Enrollment period versus annual open enrollment.
So the Medicare General Enrollment period is for those who are turning 65 and are about to apply for their Part A and their Part B, right? A lot of times when you hear Medicare Annual Enrollment period, Medicare Open Enrollment period, they usually coincide. But the difference is that's after you've already applied for your Medicare Part A and your Part B. So the general enrollment period is typically going to be January, February, March, and all someone is doing is applying for their Part A, which is their hospital, and then their Part B. And usually Part A is premium free if they've worked enough in their lifetime paying into the Social Security Administration, but there's always going to be a cost to Part B. And when they get that, they're going to want to look to get something additional, and that's where the Medicare Annual Enrollment period, which is October 15th to December 7th, comes in. So this is after you get Medicare. While we're on that, if you don't mind, I'd like to at least clarify that there are some confusing enrollment periods that correlate between Medicare, the Part A and the Part B by itself,
right,
versus getting the opportunity to purchase a Medicare supplement, a prescription drug program, or Medicare Advantage. So for example, someone may call us at the Barajas Insurance Group and say, I'm in my Medicare initial enrollment period. Well, that crosses over to someone who's applying for their Medicare. They're not even in the general enrollment period. They're in this 7-month window where they're about to turn 65 and they want to apply for the Part A and the Part B. So it's independent of, again, the Medicare supplement, the prescription, the Medicare Advantage, completely independent. But that initial enrollment period, Medicare initial enrollment period, while it applies as enrolling for your Part A and Part B, it's also borrowed in the getting a Medicare Advantage, getting a prescription plan. It's also called the Medicare Advantage or Medicare Prescription Initial Enrollment Period. So that's where it gets a little confusing when you start to think, what are they really applying for? So then you think, okay, somebody's in their initial enrollment period for Medicare. They already got Part A and Part B. Why do they need something in addition? And of course, that's where, agents at the Barajas Insurance Group, like Monique and I and others, where we come in to help define that. So there's terminology there. And then to add more, clarity to what we call mud, making it clear as mud. Again, if somebody's in their initial enrollment period applying for the Part A and the Part B, just getting the Medicare, and they miss that window, they may qualify for what they call a special enrollment period to apply for that, okay? We use the same terminology when somebody calls us up and says, we would like to sign up for a Medicare prescription drug plan or a Medicare Advantage plan. We have to ask if they're outside of a normal enrollment period, do you have a special enrollment period? So again, we're taking these terms and they could be in two different categories, And unless we're able to help someone navigate what it is they're truly asking, it can get very confusing.
And there's so many scenarios.
Mm-hmm.
So everyone's in a different situation.
Yep.
And so we just have to navigate. It's a one by one, case by case.
It really is.
It has to be. And I'm glad you said it that way, the clear as mud, because it's always so confusing. You see the commercials and you hear about open enrollment period. And the understanding is I can't make any changes, or I can't even begin to apply for insurance until October.
Right.
But that's
exactly.
not the case.
No. I mean, I'll give you a case in point. I mean, I won't mention any specific name, but I've had somebody call me recently this year who is turning 65 before October 15th. But their thought process was, I can't sign up for my Medicare until October 15th to December 7th. And I was educating them, saying, no, you're actually approaching your 65th birth month. You need to call now during your initial enrollment period, sign up for your Part A and your Part B. And once it's active, we can get you something started in, say, August, for example, and not wait till October 15th. But then even when they do that situation, they still have access to make a change to their policy if they want to during October 15th to December 7th. So they don't lose, people don't lose the opportunity to make a change to their Medicare prescription drug program, their Medicare supplement even, or the Medicare Advantage plan. They don't lose that October 15th to December 7th. But we do need to clarify, what are we really after when we say these terms? So
exactly.
That's it. So to kind of sum up, Medicare general enrollment period is for somebody getting their Part A and Part B. You know, for if they missed an enrollment period. Well, the brand new would be the Medicare initial enrollment period, right? But if they missed that, that's the Medicare general enrollment period, which is January, February, March. That's when they can sign up for that, January 1st to March 31st.
Okay.
And then, of course, the October 15th to December 7th, that's pretty widely known. That's to sign up for a prescription program, a prescription drug plan, or a Medicare supplement, or a Medicare Advantage with the prescription drugs included.
Okay. That helps a lot, because hearing these terms and not knowing what means when it's like the preliminary setup for the actual time or the changes that need to be made during a specific time period.
Yes.
And knowing when that time period is and not feeling like, oh, I missed out on it. Well, not necessarily.
Right.
Yeah.
So are there any other special election time periods that we need to be aware of as well?
Yeah. So Joe had mentioned earlier about special enrollment periods or special election periods that an individual can, be eligible for. So that's why, you definitely want to work with a licensed agent who knows the ins and outs of what you can be eligible for. So if you do miss the window of annual enrollment period, there's different scenarios. So if you lose employer coverage, you have a certain window to get on, a Medicare Advantage or a supplemental plan. Or prescription drug plan. If you have a chronic condition like diabetes or congestive heart failure, that allows you quarterly, or it's a one-time enrollment. Annual enrollment that you can get on. If you have low income, like Medicaid, for example, or LIS, which is what we call low income subsidy through the state, you can apply quarterly actually for that one. And recently now, since we've been seeing it here a lot in Texas at least, is the FEMA national disaster with the droughts and the freeze, and things like that. Those are special elections because it's all mandated, and they give us time frames for those, but those are very specific to different counties.
That's good to know.
So luckily, that has saved some people that have missed windows.
Right.
We've been able to use the FEMA as an election for them so that they're not without coverage.
Wow.
Yeah.
That I didn't even think.
And there's a ton more. There's a ton more. So like if you move out of the area, you qualify. So yeah, there's like a whole list, but those are the main ones we can,
Right.
Yeah, and it's going to vary, right? And so I hate to keep harboring back to call a local agent, go to a local agency, but it's a true statement.
It really is it's a case by case.
It is, and also to kind of clarify the point that you had made about low income subsidy, that goes through low income subsidy, known as extra help, goes through Social Security, and then the Medicaid goes through the state.
Yes, thank you.
No problem.
Well, it's always good to know that there are there's some flexibility in it, because when we barely understand the enrollment time periods, but not understand that there are some other areas that we could actually go outside of that, it's good to know. Aside from all the differences between the enrollment periods, once we actually go to apply, there are the Medicare supplement plans, and then there is the Medicare Advantage plans. These are things that I always hear about when it comes to this specific time of year. But then I also get confused because there is this conversation of Part A, Part B, Part C, and then Part D. So can you give us a little bit of clarification of what is the actual difference between a Medicare supplement plan versus the Medicare Advantage plan?
Yes, and that's a good question because it comes up a lot with a lot of Medicare eligibles that do come to us. So a Medicare supplement plan, it only covers, there's actually so many different supplement plans actually, but there's like the average one you can consider like Medicare covers 80%, and the supplement, think of it as it covers the other 20.
Right.
That's the easiest way I like to explain the way a supplement works. Supplements do have a higher premium, monthly premium, so you are going to pay depending on your zip code and your age. If you are new to Medicare, you have guaranteed issue, which means you won't get underwritten. But those are privately, the private insurance companies that offer those supplement plans, and they do not cover prescriptions. But like I was mentioning earlier, there's many different supplements that you can offer. Some you have to pay a deductible. Some, it all depends on the individual. But just think of it as it supplements Medicare. So you use your Medicare card when you show your doctor. So you're paying, your Medicare covers 80%, and then the supplement picks up the 20%. On the doctor visit, so that, as you know, it doesn't cover prescription coverage. So then you would have to buy a standalone prescription drug plan, and so then you would have a premium for your drug plan and a premium for your supplement plan. But then that would get you, the coverage that you need without having any kind of penalty on the prescription side, which we can go over another time because that's a whole other topic.
That'll probably be in Part 2.
Now the Part C, what you mentioned, is the Advantage plan. They like to Medicare Advantage plan, which I like to say the letter C means combine. So combine, the Part C combines your Part A, your B, and your D for drugs. So it combines everything into one card, one plan. And the way that works is you use one card for everything as far as medical and prescriptions. Most of them, depending on the area you are in, they're very competitive. Most of them are a zero premium, which means you're not paying anything monthly per se like you would be on a supplement and a drug plan. But instead of showing your Medicare card to the doctor or pharmacy, you don't show it to the pharmacy. Instead of showing the Medicare card, you just show the Medicare Advantage card. And the provider bills the Advantage plan.
Almost seems like that's easier.
And the way it gets funded, because everyone's like zero, it's too good to be true, zero premium. Well, they're taking it from your Part B that you're already paying into Medicare.
I see.
So that monthly premium that's either coming out of your Social Security check or you're paying it, depending on your situation. Again, everyone's different. They take that premium, and they pay whatever company you choose, whatever insurance carrier you pick for that year, they're paying that Part B to that plan to manage your health care. So you're not paying anything extra per se per month, but you do have co-pays and co-insurance for your services. So I hope that kind of explains the difference.
It does, because again,
and I know I use my hands a lot, but I'm like,
I do too. I talk with my hands.
Yes.
But that it's just when we get into the details of part this, and then the supplements, it gets to be so confusing. And the questions that always come up a lot is, what's better? What's less expensive?
that's,
And it really, you can't really answer that. And
right. It just totally depends
on your
on the
situation.
individual and what they're going through and how many times, that they go to the doctor, or if they need certain surgeries coming up, or,
Right.
It's a case by case
Yeah,
basis.
definitely
And,
case by case.
what fits one person won't always fit another. There's not a one size fits all. And that's why meeting with a local agency or agent is the real way to help a consumer properly navigate the confusion, but also, make an educated decision as to what fits their needs. Also, just wanted to add that a Medicare Advantage does not have to include a prescription drug plan. You can get a Medicare Advantage without a prescription drug plan, which really goes into different things of what somebody can do, because you can't add a prescription drug plan to that. But there are reasons and sectors of the population that would prefer a Medicare Advantage plan without a prescription drug
Yes,
plan.
and a good example, yes, thank you, Joe. A good example of what he's talking about is for our veterans, our military, who are on VA, Veterans Administration, TRICARE. There are plans that do not cover drugs, so that they can continue with their VA prescription coverage. So yes, there are different, many different plan options.
Right. Well, and I understand too, with insurance, all insurances, you have primary and secondary, but also making sure it's not, the insurance and the use of it's not being double dipped.
Right.
Which is why having the choices and the options individually also helps following and understanding the enrollment periods, because making decisions for 1 year, you're not locked into that for the years to come, basically.
Exactly.
Right. Yeah, it's always annual.
Yeah.
That everyone gets that right to make that decision. Every consumer does. And it's always wise. Maybe you don't do it, annually. Maybe you pick a plan with your agent that you talk to, and for the next year or two, it's the solid fit for you. But you should every couple of years just do a benefits review anyways, because you just never know what has changed or occurred if you're not keeping up with it. And I recommend everyone do that. At least if you're not going to do it annually, which is the recommended time frame, then do it every 2 years.
Right. Well, because life
happens.
Yes.
Your
things change.
Yes. You might move, or your doctors change.
Or the FEMA, right?
FEMA.
Like if you have a natural disaster occur, insurance is always the furthest thing from your mind. No one wants to make any changes when that happens. So yeah, life happens.
True. And so this is that time period of year that I see a lot of commercials increasing. I see even down to text messages, receiving phone calls that are all agents or agencies that are trying to sell services.
Right.
And this is one area, the only reason I was aware of this was because I had to switch my number, or my mother's number, to be my number. And that's when I started receiving a lot more phone calls.
Oh, yeah.
And it was really frustrating because my mother doesn't know all this information, and it didn't take much to confuse her. So have there been any changes with the compliancy of how this is actually marketed to the public going forward?
So speaking about the compliant changes that have occurred, one thing I'll mention to kind of wrap up what was just discussed, which is, no compliant agent or an ethical agent as well should sell somebody a Medicare supplement with a Medicare Advantage plan. That's just a compliant thing that's been through and through. And it just, since we're about to talk about compliance, I'd like to at least say that, for everybody listening, no one should sell you, if you have a Medicare Advantage plan already, a Medicare supplement on top of it, because the supplement will not work. Medicare supplement will only pay if Medicare is the primary, and Medicare is not the primary when you have a Medicare Advantage. So it's I know that's not directly the question you had asked, but I wanted to kind of sum up what we were just discussing as far as Medicare versus the Advantage plan, Medicare Advantage plan. But as far as some of the compliant changes, I'd like to definitely touch on that, just because it's important for us. Everybody should be trying to be compliant. We, as Barajas Insurance Group, focus on compliance. It's our number one thing, which is important. But one thing that has been occurring is that these TV ads spark a phone call from a consumer. They take they call in the 800 number. The intake person on the other line takes the phone call, speaks about one benefit from a different company, doesn't even do a benefits check, doesn't do a doctor check, a prescription check, an income check. I mean, there's a whole bunch of checks that need to be done for an agent to properly, help and advise, right, a consumer into which plan's the right fit. None of that is being done or was being done properly. And so Medicare is requiring that, if there's an intake call coming in, then it needs to be explicitly explained that this is a new plan that they're switching to. And they need to review whether their doctors are taking the plan, review the prescriptions and what their copays could be, or whether the prescription's actually covered, and make sure that that person on the phone is completely aware that they are changing from one insurance plan to another and getting a brand new ID card, that this is a full change, not just because we talked about one specific benefit,
right.
And that you're just getting that one benefit enhanced on top of your current plan. Because that was some of the confusion. I have this plan, whatever this plan is, and this benefit I heard on the phone and saw on the TV, that's why I called in, I'm adding that. No, it doesn't work that way. You are completely switching. And a lot of consumers were not aware of that. And that's part of what compliance is requiring agents to do, not just Barajas Insurance Group agents in the field, not just agents like us, but people on the phone. Yeah, this is a national thing.
Exactly.
Recorded.
Yeah, and like, I'm sure a consumer probably doesn't care to sit there and worry about the compliance that we have to follow, but like, we're going to have to make sure they sign what they call a scope of appointment, which gives us a permission to go over the list of things: Medicare supplement plans, Medicare prescription plans, Medicare Advantage, just the list of things. They're acknowledging that they're agreeing to meet with a licensed sales representative to come out and talk about these products, whatever these products are, and that they have acknowledged and agreed to it. But they're not agreeing to any sign up. They're not agreeing that because we're having this meeting, they're going to enroll in anything. It's just to discuss their benefit options, right? That's called the scope of appointment. And the rule is, if we're doing any kind of educational event, or if the phone call comes in and we're trying to meet with somebody, we have to make every conscious effort to meet with them 48 hours later. There needs to be this cool down period. Or if there was already an original conversation on a different product line, like say life insurance, right? Gotta give them 48 hours to cool down before you can just go right into, hey, let's talk about whatever, Medicare supplement, Medicare Advantage, Medicare prescription. Give them 48 hours to cool down.
Interesting.
Set up the appointment 48 hours later, get the permission, and then go out and see them. And there's a bunch of other compliance when it comes to how we market on the website, how explicit it needs to be.
I know you had asked about the best plan for you or better. We can't say those superlatives because, like we were mentioning, I think that's the theme of this episode is it's a case by case. What might be good for one person might not be good for the other. So
we always want, when we get to these topics that are so in depth and have so much information, we always want to be told what is the best thing, what should I do. But
and we've been on your episodes before where we have actually said, the reason I'm glad that we can't use superlatives like that is because everything is relative to the person. Right. So it would be like me trying to tell you, hey, Jess, this Coca-Cola is better than Pepsi, right?
Right.
I mean, not that we drink soda, but the point I'm making is you're trying to tell somebody who might have a favorite.
Right.
And it's whatever reason it's their favorite. For whatever reason, doesn't matter. That's their favorite. So who am I to say that one's better than the other? So it's always relative to the person. When it comes to that. And then to kind of wrap up the compliance, like I said, there'll be some things on most people's websites that need to be compliant. Phone calls, when they're being recorded, all those have to be recorded during the sales process. And then, the one thing that Medicare would like us to do is make a mention as to who do you offer. You don't have to list the actual companies, but if there is, I don't know, I'll just say that there's 20 companies in Texas that are out there that you could look at. How many, when I'm calling you Joe, how many of those companies do you offer and how many plan options are there? We have to state that so that the client knows they don't have access to every single plan when they talk to me. If they want to have access to all that, then they got to go to Medicare.gov or call 1-800-MEDICARE.
Right.
So,
well, you have definitely mentioned before that it's in their best interest to reach out to a local agent. And in the best interest for the listeners, what area is it that Barajas Insurance Group covers?
So currently, obviously, Texas, which is what we probably advertise the most in, but we are also in Louisiana. We're in Georgia, Florida, New Mexico, Nevada, and West Virginia. And I'm pretty excited to say that in January, sometime in January 2024, we'll be in California and Colorado.
That's fabulous. Reaching more caregivers. And the caregivers that may have questions to get in touch with you, how do they reach you?
They can absolutely go to our website, which is biginsurancegroup.com. You can also find us on Facebook, Instagram, LinkedIn.
So I'm glad that we went over this information because you explained quite a bit. And every time I think I understand, there's always more to know about. And there's changes that take effect.
Absolutely. Every year. And we have to get certified and renew our, licenses every 2 years. And we have to get certified every year for
continuing education every 2 years.
So that is why, we love what we do, and we love educating everybody who's interested in Medicare or who is Medicare eligible, and just letting them know all of their options.
Good, because there are caregivers out there of all ages. And whether they are in the group, what is known as millennial caregivers that are caring for parents or grandparents, this information is not easy to understand. Right. And it's helpful to have people like you guys to
talk through it with.
To talk through it. And
thank you.
Especially when you don't know what question to ask because there's so much information. Mm-hmm. But you know the questions to ask to help
to start the conversation.
At least getting an idea of what their needs may be and what they might need to get covered.
Yeah, and we love educating as much as we can because that's really what this is all about.
We've been doing we've been doing this for 15 years, and we love what we do.
That's awesome.
Yeah.
Well, I love what you guys do, and that's why this information, like I said before, we can't just gloss over this kind of information because there is quite a bit to learn. And so this part 1 today, and then coming soon will be part 2. And in part 2, we're going to go over the actual amounts that we can expect, estimated or specifics, for the increases of Part B or Part D, and then even go over to some of the other areas that are starting to bring up some more questions regarding another acronym when it's related to Medicare, which is called the IRMA. So please feel free to send some questions in if you have any, if there's specifics that we can actually get some answers for that. But if not, tune in next time. And until then, I hope this episode gave you some food for thought. And be proactive. Take care, everybody. Bye.